need to give it about a minute or so for everyone to be able to come in.
No problem. Okay.
All right, we are now live, so.
Okay. Thank you, President Ms. Burke and the rest of the board members for giving me this opportunity to give you an update about what's been happening with the COVID pandemic in our community and what our status is in regard to the cases. We look at 5 factors in terms of determining community spread of the COVID-19 virus. And those 5 factors are: number 1, the number of cases we are seeing increasing in our community. And when we look at those cases, we look at what we call a 7-day average, because you may be up a little bit one day and you could be down another day. So what's the average number of cases per day over 7 days? Our second criteria, which is probably the most important criteria for us in terms of reopening schools, is what we call the positivity rate. Positivity. What that means is, of the people we test in one day, what is the percentage of those people who have a positive test? So if I, example, tested 100 people and 30 of those 100 individuals are positive, I would have what's called a 30% positivity rate. And we look at that over a 7-day average. And then our third factor is we look to see how many patients in our community are having COVID-19 symptoms and are going through the ambulance ER visits to be evaluated. So we call our ER visits. Then our fourth criteria is what's the percentage of hospitalizations of individuals who have a COVID-19 infection that are being hospitalized. And then our last factor is our deaths related to COVID-19. Now, let me say that the demographics of who is getting infected has changed considerably since the start of our epidemic, starting in like late March, early April. So at the beginning of the epidemic, almost somewhere between 45 and 48%, about 40% of our epidemic in the beginning were in individuals over the age of 60. So at the start of the epidemic. And I think at the start, we might have had just 3% of children between the ages of 0 and 19 who were infected with the COVID-19. Now, fast forward to like the last 4 weeks of this epidemic, the number 1 age group that has the most cases, I believe almost like about 38% almost, are the age group 20 to 29 years of age. And then the next group who has the next highest cases is that age group between 30 to 39. So the majority of our cases are between age 20 to actually 50 years of age. And we see a significant drop in the number of cases that are occurring in our seniors. But when you look at the children between the ages of 0 to 19, that percentage went from 3% up to 11%. But when we break that down, so who is it getting infected? Is it the 18, 17, 18, and 19-year-olds, or is it someone like in elementary school? So we were able to determine that it's primarily in the older age group of that 0 to 19 when we looked at the numbers, okay? So very low positivity, very low in the 0 to 5 years of age, and very low in the 5 to 10% of age. So they don't transmit this virus like you would normally see, like if they had the flu or some other viral syndrome between the ages of 0 to 10 years of age. But once they are older than 10 years of age, going up to high school, they are transmitting, maybe not as high as adults, but they are transmitting considerably more than the elementary children. So middle school and high school have a higher rate of can transmit infection if possible. Now, when we look at all the 5 factors, I'm going to tell you where that status is. And that is, we are basically flat in hospitalizations for COVID-19. Our deaths have dropped down substantially, but remember this, we are a lot smarter now. We do better care for our patients with COVID-19. We've got medications out there now in the market for treating COVID-19. So one, because the demographics is a younger group of people in their 20s and 30s that are getting infected. And so they don't have the chronic medical illnesses that say someone who is much older. So that's why we're seeing the deaths drop, I think, significantly because of those 2 combined factors. Our hospitalizations have been basically flat for the last 3 weeks. We have not seen a significant increase at all in our hospitalizations, primarily in the last 3 weeks. But we are seeing a slight increase now with our ER visits. And the one factor that we really look at is our positivity rate. And what we say is, is that if you had a positivity rate of 5% or less, you could go back to school in person with everybody, no problem, at full capacity, if you had a positivity rate of 5% or less. Now, between 5% and 10%, between 5% and 10%, I'll call this person back. You can open schools, and you can open those schools if for all your elementary children, they could come back in full capacity because the rate of transmitting infection is so low. But if you're a middle school or a high school, you could not come back in person in full capacity. You have to have something that we call a hybrid system. A hybrid system means that you have a combination of being in the classroom maybe 2 or 3 days out of the week, but the other 2 or 3 days you are at home learning your education. Now, you can also have a hybrid system, for example, that you could be full capacity for 1 week with everybody, but the next week, everybody has to be off and do communication. The third thing I have to say is sometimes if you have smaller schools, you don't have to do this hybrid model, what we say. For example, if I have a school that has the capacity of 600 students, but I only have 100 kids in that building, that's all for my total school, then I would not have to have the hybrid model because I have so few students. I've got so much social distancing. I'm wearing masks that I don't have to have a hybrid system related to the children coming back. So at that 100 students, they could be at 100% capacity in person every day. So at 13% is the number we're looking at, that if we reach 13%, nobody can be in the classroom in person at all. Now, if we're at the percentage of 11 or 12%, we could only allow elementary children to be in the classroom in person only. Middle school, high school cannot be in any in-person classes if we were looking at 11% or 12% positivity in Marion County. Now, let me say this. Our guidelines may be stricter than the state, okay? And I would not be surprised, I believe, that the state's guidelines, and I don't want to speak for them, but we may be a lot stricter in terms of their guidelines may be that you need to reach 15% before no one could be in person in the classrooms. We think we're a little bit different though, in terms of the entire state, in terms of population density. So we cut off at 13% where nobody can be in person. But these are the things that I think now, while I'm telling you this, guys, I'm giving you a preview, because who makes the final decision for this is our mayor, okay? And honestly, I've not presented this data yet to the mayor. I will be doing that just tomorrow morning and see what he says, but I feel these are good recommendations, all right?
Mm-hmm. So with all of...
and so where are we now with the positivity rate for the community? I'm sorry. That's the main thing that we need to know.
That does become the next question, yes.
Right. So about June the 24th, we had reached down to 4.2% positivity rate. We were less than that 5% when we were telling schools to, you can get prepared and we think we can reopen. And then we opened right after the July the 4th holidays. And I think we went to stage 4. We increased social gatherings to 250 from 50 social gatherings. We opened our bars and taverns. We opened our convention center for a number of activities. We expanded capacities in our indoor dining and places of that nature. And so we saw our positivity rate shoot up to 10.9%, which we would still be able to open schools, but it was a major concern for us. Mm-hmm. So in the last 2 weeks, we've slowly started coming back down. We were hitting the high, the low 10s, and then we eventually went to the high 9%, 9.8, 9.6. This past week, we have reached down to the 8%, where we've had like 2 or 3 numbers, 8.8, I think 8.7%. And so we think we're going back in the right direction. And the number one reason we really think is why we're starting to go in the right direction is that when we required the face mask covering as a requirement and not just a recommendation. Because we had a numerous number of folks that out in public would not wear their face covering. And now we have all the businesses making these requirements and everything related to this. The second factor is I think we have increased the number of tests available for people to be tested in our community. We've really upped the number of tests related to that. So you're going to find more cases, but you have a better job of doing the contact tracing related to those cases so that we can identify early people who may be infected and they need to self-quarantine for a period of time. And with the recent closing of the bars and taverns, reducing our social gatherings down significantly, scaling back a number of the precautions that we put in place, we're hoping that this percentage will even continue to decline, although it's kind of slow right now.
Okay, so I don't want to put words in your mouth.
Okay.
But what I am hearing is that where we currently are and in the 8%,
Yes.
you consider schools safe to open so long as middle school and high school is on a hybrid model of some sort.
That is correct.
Okay.
Yes.
And you have given me my next couple of questions that I had, which were on what metrics should we look for, and you gave very exact answers, so thank you so much. I truly appreciate it. Our next big concern becomes about handling staff and student members when they are sick or when they're positive. Can you tell us and walk us through how that situation works out?
So normally what we request of all schools in Marion County, that when you identify a child or maybe an employee like a cafeteria worker or someone in environmental services or administrative clerk or a teacher or a student, you're required to report that to us within 24 hours so that we're involved in the contact tracing related to your employees and your students. And so we would give you guidance about who would need to be tested, who would need to be self-quarantined, maybe for a period of 10 to 14 days. And for parents who may not have the ability to have a primary care provider or the money to do testing, we would provide that testing for them free. And depending on the number, we have what we call response teams that can come into the school system and actually do the testing within a building. Okay, I apologize. Can I just put my little kitten out of my apartment? I'm so sorry.
Yeah, it's okay.
Okay, I so apologize. I apologize about that.
It's okay. It's usually my dog's barking, so it's a nice change.
Okay. Okay. So we would help draft letters to the parents who would need to draft those letters. We already have a lot of template letters like that. We have a lot of experience related to outbreaks in schools and what to put in the letter. We will make numbers available for any concerned parents, like a call center. We always are able to do education to any parents or anybody who would be concerned. And so we would work hand in hand, whoever you designate as your medical person.
Okay. So is there a difference if we have, let's go with a middle school class of 15 people in the classroom. Is there a difference if we have one student test positive than if we have two students test positive?
So yes, it's a big difference. So if you have one person test positive, you couldn't necessarily say, and if you're in this, we're asking, requesting that every student stay in the same assigned seat, which helps us from a contact tracing standpoint. And if you have your safeguards put in place in terms of social distancing, and if we also could based on our investigation, know that there was someone in that person's home had symptoms and was diagnosed as positive, if I knew that the students were not within outside the 6 feet distancing and they were wearing masks, I would not have to self-quarantine anyone in that classroom. But I may have someone that's within a 6 feet radius. And because some of the recommendations, you can be at a 3 feet difference, 3 to 6 feet, based on the American Academy of Pediatrics. So if you're less than the 6 feet, then yes, we might ask you to be tested and do a self-quarantine for the 10 to 14 days in the classroom. And only those individuals who are within 6 feet of where that person was seated, would that be the indication. Now, let's say we have 2 students that are positive in that classroom, then unfortunately, we would have to self-quarantine everyone in that classroom if I have at least 2 within a classroom, not the entire school. I would not have to close the whole school. No way, just that self-quarantine of the individuals in the classroom if there are 2 or more cases. But we have to do investigation of those 2 and see, maybe they were in a social gathering we weren't aware of, and it might not even have anything related to the school. It could have been maybe somebody had a birthday party and they invited all their friends to the birthday party and they weren't doing social gathering or wearing masks.
So about how long, and I know it's not necessarily a specific number, would an investigation like that take, or are we talking about, so if we find out about a positive student, we tell the health department about a positive student, or 2, we'll say, we'll escalate it a little, and you guys have to do the investigation. And I know that we're supposed to help with contact tracing with assigned seat charts and things like that in classrooms.
Yes.
How long is the other side of that till we know back as a district, okay, we need to quarantine the classroom or just individuals within 6 feet or things like that?
It's usually within about 24 hours we can make that determination.
Okay.
After we've been notified we have a positive person. So
Okay.
we've had outbreaks with tuberculosis in school systems. We've had outbreaks in measles. We've had outbreaks in Shigella. So we have a lot of experience in outbreaks. So it's we have special forms, a questionnaire that's already set up. We answer our questions, and depending on the potential number of students, we have more than multiple response team members that someone might be handling one different aspect. Several nurses, you've got these contacts to take care of, and we try to do it in a really quickly, rapid manner.
Okay.
And we are in the process of hiring 300 more additional contact tracers currently going on now, so that's going to be above our health department's 75 contact tracers. We also know that the State Department of Health has already hired 500 contact tracers for the state of Indiana, and I want to say that at least 100 to 200 are concentrating in Marion County. So I think we're going to have a very robust contact tracing system for the city of Indianapolis.
Okay. And I really appreciate hearing that. I know here on the east side, testing is an issue. There aren't test sites really close to our community or within our community. I believe you mentioned earlier that the health department could help with that under some circumstances.
Yes, so let me just tell you how we do it. So if we have an outbreak and it's happening in a school system, we would make available our resources for testing. So depending on how large the size, we might ask you to come to our test site, or you may have a large building where I don't have to worry about students being infected, where we might have to bring the van to you and do it through a drive-through or walk-through where we could test you. We do what they call mobile van testing. We had a mobile van testing in a hotspot area this past Saturday. Now, we were expecting just about 100 folks to come in the 4-hour period. We ended up having 600 show up. We just did a little bit too good a job, I think, in our advertising. So my team didn't get to go home for a long time, and we had to cut it off. But we do have the ability of doing hotspot mobile testing. And if your lot is, drive-through or parking lot is large enough, we can bring that testing to the school if there are any significant number of people we need to test, teachers, students, or whatever.
Okay, I appreciate that. Thank you. What about if we have students or staff who have symptoms but refuse to test? How does that change how we have to handle things?
So if you had a student who refuses to test, we have to make the assumption that that student is positive.
Okay,
So if they refuse to get tested, they're considered positive, and we would have to quarantine them probably for 14 days.
Okay.
They would have to do telecommuting related to that.
Thank you. So we've had some confusion, well, not really confusion, but as you mentioned earlier, the American Academy of Pediatrics, I think the CDC changed yesterday. So there's this 3 to 6 foot range that that students need to be separated by for social distancing. But you would still contract trace anyone that's within 6 feet for more than 15 minutes.
Yes, yes.
And any help on what the difference in those two things are?
So let me just say that the gold standard, if the gold standard is the best, where you can have 6 feet distancing between the students. But let's be realistic.
Right.
Our buildings were built like, if you like our building, was built a long time ago. Mm-hmm. So we don't have, from a practical standpoint, the ability to make sure every school structure is able to do the 6 feet distancing. And we have a body of what's called the American Academy of Pediatrics. This is a national body. They get their best experts from the Academy of Pediatrics. There's science folks from Johns Hopkins, Harvard, UCLA, all over the place. And they made the recommendations that if you could at least do 3 to 6 feet, all your seats facing in one direction, that's acceptable. But I drive a Ford Taurus, and I love my Taurus, okay? Mm-hmm. But someone might consider a BMW or a Mercedes or a Lexus as the gold standard. And less than 3 feet, I might be able to get a car off the junkyard, and it can get me around, but it'll get me where I go, but it's not as good of the standard. So you have more protection with 6 feet than 3 feet.
Okay, thank you. And I appreciate the analogy a lot. So let's say that we have someone who goes out and get tested that we don't know is going to get tested. So let's say we have a student who goes and gets a test. Now, I know from the reading I've done that the Indiana State Department of Health and Marion County says that they're supposed to inform schools if the test comes back positive, but the student or their parents are supposed to inform. But let's say that they don't take that step. So we have a student, they go get tested, they're positive, and they never inform the school. Will we find out about that test result in another way?
Yes, you will. So any person that's tested, I have to tell parents, and I have to tell students, and I even have to tell faculty and staff. So when you're tested, that lab report that's positive goes to the State Department of Health, and they in turn will give that report to us. And so if we can identify this person is a student, and we ask for their occupation, and if they're school age, we're going to try to determine, unless they're dropout, and we will have to determine that and assure ourselves, if they go to a certain school, we would notify the school authorities, because we have to figure out, how did this person get infected? And has he infected anybody else in the school system? So yes, your bottom dollar, we would need to inform you.
Okay, thank you. That's good to know. So I know that if we have a student tested, if we have a student who's positive or a staff member that's positive and we put in place a quarantine, you have letter templates that we have used
Yes, really.
and sent home. Is there any other communication if someone is formally quarantined so that we know that they have a contact with a positive? So they're within.
So we would be working real closely with you because we don't want to have anybody else that might be infected. So until that case is closed and until that student or employee or whatever returns, you would be kept abreast of
Okay.
where that investigation goes.
Okay.
And parents will have the ability that if they want to ask questions from someone who has a level of expertise related to the COVID-19, they can call us. We will have a call center available for them to call. And we know we can respond with Hispanic interpreters, and we have interpreters for other language as well.
Okay, so kind of shifting, but not real far. Does the county and does the state have enough testing supplies for school to start up again?
So that's the elephant in the room, okay? It just depends on, we have not yet made our decision about sports. So sorry, I wish I could answer that today. We will have it ready by Thursday. So it just depends on whether we approve contact sports. And if we do, we have a rigorous testing requirements related to that. And so that might require a lot more tests than we have available. But I do know, and I can't announce this because the mayor wants to announce this, that for the school systems, we got some big surprise where the schools should be okay with their collection tests, but I'm not the big.
Watch the press conference on Thursday.
Yes, please.
Okay.
Please. So we think we have a sufficient number, definitely for the school systems.
Okay.
Because there are some people who are going to take special care for just schools. If you were like a church or something, a business, that's a different story. But we're really trying to make sure we're going to take care of our kids and our supporting staff.
We really appreciate that a lot because that, like I said, that's been a concern we have heard. So could you review with me? I know that in a pre-coronavirus world, there were certain guidelines that were used to determine if a building had to close for a period of time. Could you review with us what those guidelines are and also whether or not those guidelines have changed in any way now that we are in this coronavirus period?
So I know that let's just take, for example, influenza. Mm-hmm. You could close a school, but you had to have at least a 20% absenteeism rate for influenza to close an entire school. And what we're using for the coronavirus is a 13% number to close, to close the school. That is where it's essentially virtual learning. So Melissa McMasters, are you on?
She is on, I believe.
Okay.
I am.
Oh, so do we know, she's maybe a little bit more up to date in that regard with other viral conditions, but I thought it was 20% absenteeism for influenza.
It is. With influenza, it's 20%, and we don't necessarily close the schools. We just like the schools to contact us so we can make a decision. But the 13% you're talking about, Dr. Caine, that's the positivity rate, right?
It's for the coronavirus, yes.
So we're using
But there's a different little criteria. So we use how many kids are absent from a viral infectious diseases versus we're looking at the positivity rate, not in the school's positivity rate. We look at the community's positivity rate. So that's a difference. Someone says, well, my school doesn't have any cases. Why should I have to close down? So we do look at the community-wide spread.
Okay. So thank you. Sorry, I'm trying to read and talk at the same time, which is hard.
Okay.
So my understanding, and I think you covered this a little earlier, but I want to recover it, is that you have a contact that is in essence assigned to either Warren Township or the school system should we need to contact them, correct?
That's correct. So we're going to require every school, when we review your plan, to tell us who is your health contact person that we need to know. Let's just say I may hear of a case that's positive from one of your students. So we would like to tell that health contact person, but we'd also tell whoever is your principal or your superintendent related to that case as well.
But you have a staff member whose primary job will be working with schools then?
That's correct.
Okay.
Right, and this is Melissa. I would like just to add, so right now we have a group of nurses that's responding to the schools, but as we get more and more contact tracers, we would like to assign one tracer to a school district so that you had a constant contact that you were familiar with. So we're hoping to get to that level.
Thank you.
Welcome.
So let's discuss kind of some topics that we hear a lot. The first one is school buses. So there are a lot of different guidelines surrounding school buses. We are doing a reduction in capacity by percentage. Are those guidelines that you are recommending? Is there something to help that Marion County Health Department?
So they're different scenarios and different models. For example, we like only one student per seat. If you had the possibility of, you can go crisscross. So the next row, someone in the next seat, not necessarily in front of you, but someone opposite you in the next seat. And if you are children, you may have multiple children from the same household. I don't mind multiple children sitting on the same seat, no problem. You can have 3 kids on the same seat if they're coming from the same household. So trying to do as much social distancing as we can on the bus, while they would be required to wear a mask, and the bus driver would be required to wear a mask.
And we do.
And we're even asking that kids, if we can, sit in the same seats all the time, that they be assigned seats, and we like, if possible, for them to stay at those same seats all the time.
And does that change for, and I know athletics is a whole other conversation, but so let's not say athletics. Let's say we have an extracurricular, we have a brain game or trivia team that is going to go compete at a different school. So it's the same guidelines for the bus trip.
Yes, exactly.
Okay. So you said that you weren't able quite yet to give us definite answers about athletics. Is there anything in specific that, so my assumption is that we should not be playing anyone out of the state for now.
So here's where I think it's going to get dicey, and one of the things we're looking at. So if we have contact sports, and right now I'm only just looking at for August, September, October. That's the only things I'm concerned about, because you know what, it's difficult for me to say what's going to happen November, December. So I'm only just worried about, let me try to get the guidelines for the sports now, especially as people are starting to practice, they're getting their equipment or whatever. So what would I need in order to feel comfortable? Let's just say the football team. So I would probably tell you at the start of their practice, I would like the team and all the staff to be screened for COVID-19 from the practice. Now, if we have an actual game, I'm considering like the NCAA, that you test your team and all your staff within 72 hours of the game. And of course, they'd have to have the results back, but I would like to know the team that you're playing is following the same policy. So it's easy if you're playing someone in Marion County,
Right.
But if you're playing someone outside the county, they may not want to comply with that. And so do I let that persuade me or not? I don't know that answer just yet. So we're getting a number of pediatric infectious disease experts within today and tomorrow, trying to make that decision.
And is the same true for, so if we're just talking fall sports, we've got boys tennis, girls golf, and
So
cross.
tennis, hey, I don't consider tennis a contact sport.
Okay, so not,
Primarily, if you're outdoors, for sure, that's fine. You can golf. That's fine. I don't have a problem about that. Essentially, almost volleyball. Now, some say that, you know, when the young lady is standing in front of the net and the other opposing player is standing in front of the net, they may be within 6 feet. So we could, you know, you can adjust the game for volleyball to say, hey, you're just not allowed to stand in front of the net. It may make it easier for them to spike that ball over the net, but there's some ways that you can do it, and I don't consider that a real contact sport. And I did, let me just say, I did talk with the new commissioner for the Indiana High School Athletic Association, and we've been looking at getting guidance from them as well, and expertise, and they've got some good recommendations too. So we're looking at that very, very carefully.
what about non-sport extracurricular activities? Do you have any concerns about those? And
So we would have problems. Let's just say you have a choir, and you have a large choir. I really wouldn't like you to have large choir singing events because of the spread of the virus. I think there's a way that bands can still take place, but I'd have to see your plan and the safeguards that you put in place in order for bands to practice related to that. Cheerleaders, I don't know if you guys have cheerleaders. So there are a number of extracurricular activities of that nature, but I would say I would not want any like large assemblies in your school system, something that you're normally used to doing. I would try to cut that out. What else for extracurricular activities?
so we have a lot of robotics teams and things like that as well in our schools.
So robotics, so what is a robotic team? I'm sorry, guys. I know I'm old school and
They do exactly what it says. They build and engineer robots.
Robots. Oh, yes.
Right.
Oh, well, we have that in our churches, but they call it something else. Okay.
Okay.
So, you know, robotics can take place. They just have to make sure that they're social distancing. So we'd have to just see how they do their robotics.
Okay. So your concern with extracurricular activities is the social distancing aspect and
Yes,
keeping everyone safe
definitely.
that way.
Yes. No contact. Okay.
Okay. So got two more questions I think we've got time for. So one of them is, I know that you talked about this 13% positivity rate earlier. Would that affect, and this is a very specific, so we have one of the career centers in central Indiana, Walker Career Center, and right now CTE, Career and Technical Education, there are different certifications that require a certain amount of seat time, for lack of a better way of putting it, where kids have to have hands-on experience for a certain number of hours. If you're closing down the schools, if it gets to that, would that also affect our career center, or would that be a conversation that we could still have?
I think that's a conversation we can still have, because your career centers might be a little bit different from your school system. So I will want to just say automatically that they're closed. I just have to have a little bit more information, have a better perspective of what that entails.
And I really do appreciate that answer, so thank you. And then we get a lot of questions. Obviously, our staff are concerned about coming back to work. I think everyone who's going back to work is concerned. And there have been a lot of things going around about what staff should or should not do when they return home at the end of a busy day. So should they, excuse the bluntness of the question, you know, drive into their garage, close the garage, take off their clothes, put them in a laundromat, before going in, or what level is that level necessary? Is there a level you would suggest to keep their families safe?
So I think that I think all teachers should have what's called hand sanitizers in their car, so that when they're going to, you know, here's where it's going to be crazy. So for all your elementary children, for example, I may tell you and your staff, we're looking at this, that everybody has to wash their hands when they come into the building. You don't make the assumption that your staff and your children are going to do it. Everybody's required to wash their hands coming into the building. And then when you have teachers that leave for the day, it would behoove them to wash their hands before they leave the facility. And if they're not very good about that, then remember when they're opening a car door, they can contaminate that car door getting into their car, putting contaminated hands on their steering wheel. So I would like, if whether you're parking your car in your garage or getting out of your car, you may want to use hand sanitizers on your hands before going into your house. I'm less concerned about the COVID-19 getting on your clothes, unless maybe you may have special ed children that you have a closer contact with, or you may have younger children that just love to come over and hug you, no matter how you try to do the social distancing. So I think in those cases, it doesn't hurt you to come into your house and immediately remove your clothes and just put it in a garment bag. And you can wash your clothes with COVID-19 with your other clothes as long as you're using hot water and washing your clothes and not cold or warm water. It needs to be hot in the washing machine.
So does that mean we should also tell our families to wash their masks in hot water?
Yes, I would recommend that you wash your mask in hot water, yes.
Okay.
And I guess, Melissa, we can maybe get some simple guidelines about the masks, that a little message that we can give to parents about how they care for their masks, face coverings.
That would probably be helpful. I know that we've put a lot out there about our expectation about students and masks, but I don't think we've got a lot of great signage on social distancing and washing your hand and using hand sanitizer. But I don't know if we've had that discussion about washing the mask itself and how to do that.
Yes.
So we have just a couple minutes. I have gone through kind of the big questions I had. Is there anything else you feel it is important to share with us?
Melissa, what am I missing?
Well, there were some Q&As in the chat. Do you want me to?
Sorry, I see one chat. I see questions and answers. I apologize. Let me look at them right quickly. Sorry.
One of them, I was trying to chat the answer, but it'd be easier. The question was why younger children tend not to be spreaders. And I think that has to do with the fact that they don't have symptoms. They're typically asymptomatic. So if they're not coughing, they're not sneezing, it's very hard to spread. I don't know if Dr. Caine, if you have some more insight into that.
I think they really don't know all the reasons why they are such low spreaders compared to the middle school and the high schools. But I think that's part of the factor related to that, Melissa. But I think they don't know all the science as it relates to that. Could they have some kind of immunity because they're exposed to so many viruses as young children compared to when you get an adult? Is it providing some partial immunity related to that? So I think all the rationale is not known.
And we had some questions about the safety of passing periods, which are of course always a concern. Our passing periods, I don't believe meet, well, I know for a fact they don't.
So usually if your passing periods, if you can get into a room and your passing is less than 15 minutes, your risk should be very, very low.
From the passing periods.
Essentially almost non-existent if you are passing from one room to another and you don't allow them to load a ladder in that hallway for like greater than 15 minutes, talking to each other and I don't know, going to a locker or whatever and socializing.
And then I know that you said that you were looking into guidance for athletics. There have been questions,
Yes.
I know questions among the board as well. Will the health department also be putting out guidance for singing and
Yes,
dance?
so we can put out guidance for singing. So like I said, we can't have large choirs and we can't have a large amount of singing because it does, with a larger group, put out a significant amount of respiratory droplets by singing, unfortunately.
And then a really good question about, so if a parent is tested positive, would the health department be able to trace that parent to a student to make that connection?
Yes, so normally what happens is that if a parent is positive, we do the investigation of who was in the household.
Okay.
And if we had a parent who was positive, we would probably make the recommendation that their children, because they're contact, they'd have to be self-quarantined. They would not be allowed to come back into the school until the 10 or 14-day period is over. If we identify an adult, and usually we want to know who's in that household. So if we have school-age children, anybody in that household would have to be self-quarantined if they lived in the household with that parent, or they're spending considerable amount of time with that parent.
Okay. And sorry. Also, a teacher specifically asked about N95 versus cloth masks versus face shields.
Okay, I can answer that. Okay. So the N95s are what is primarily used in the hospital settings. So it is the highest standard you can have for safeguarding against coronavirus. And so that's the mask that we predominantly like to use when we're in critical care units. We have patients who are coronavirus positive. They may be on a respirator. We have to be very close to that patient and taking care of that patient. And so we try to reserve those N95 masks for hospital personnel. And it just honestly just wasn't until recently, about 2 or 3 weeks ago, were we able to get some N95 masks for our hospital staff, and the effectiveness is probably 99.90-something%. That's just how effective the N95 masks are. Now, when we couldn't get N95 masks, we were using the Japanese Asian version of a 95 mask. They're called K95 masks. So they're close. They're somewhere, the effectiveness is probably around about 92-95%. They're pretty decent, but they're not quite as good as the United States made N95s. And then we go to what's called surgical masks in terms of how effective is a surgical mask. So we're probably looking at a surgical mask being probably almost 90% effective in terms of against the coronavirus. Now, how does that compare to a face covering? So a face covering and what's called a face shield. So the face shield has about a 67% effectiveness, the face shield, 67%. But in certain instances, it may be greater. So like if you have year-round children that may be spit or you may vomit or something like that, you don't want those respiratory droplets dropping on you. So it depends on the type of contact that you have. And then the next is the face covering after that. And so somewhere probably around about, I would say about maybe about a 50 or 60% effectiveness.
Okay. Well, it is 3:59, and I know we had you for an hour. So I would like to thank you so much for your time. And you too also, Ms. McMasters. Thank you so much for answering our questions, and thank you so much for your time.
So thank you, and always open in order to answer and address some questions. And if I could, I would love for our board chair to give me a call with Mr. Hanson, your superintendent. You have a dynamite superintendent. He's just been fantastic giving us the logistics of what happens in the school systems. And so we've appreciated Mr. Hanson's input. But if you, Mr. Hanson might want to give me a call, or Ms. Burke, just right after this call, unless you guys are going to be meeting afterwards. You can call me a little bit later.
That we're in the same building, so we can work that out.
Okay, thank you. And I think you both have my cellular mobile phone numbers.
Okay.
And
Thank you so much.
this is Melissa. I went ahead and put my contact information in the chat room.
Okay.
All right.
Thank you.
Mhm.
And
So
again,
thank you.
both so much for your
Thank you
time.
again for having us. We're both of us were very honored to have the opportunity to be able to give you a status update.
Well, thank you so much for your time. This is, you know, I think every school board has said it. This is the biggest situation any of us have ever dealt with by far.
So I will honestly, we've never seen an epidemic like this, and I pray we never see one again. We had Ebola, but fortunately for us, it was not as contagious as coronavirus. Very scary, but not as contagious. So it's a new day, and things are changing, and these bacteria and these viruses are becoming very smart, and they're able to mutate. And this is coming from the same family as just the common cold. The common cold, but a strain mutated, and now it's very deadly and can have severe consequences for everyone. So everyone, please wear your face covering when you're out in public. Do your social distancing. And if you have a birthday or a special celebration, see if you can do the social distancing, and just be very, very careful out there. And we can get there very quickly with the new norm if people are doing the things that they need to do in order to safeguard all of us. So thank you very much. And I will say on behalf of Mayor Hotsett, a lot of attention with his staff. Mr. Paul Babcock, who's Director of Public Health and Safety, a different amount of research is going on. And what I didn't tell you, who are my expert panel expert people. So get you a little understanding who that expertise is. So we have on our expert panel someone who was Director of Public Health Practice at CDC. We have a former state health commissioner, okay? We have a number of what's called infectious disease epidemiologists. We have a former health commissioner of one of the largest cities in the country, New York City. And we've consulted with the former director of the Centers for Disease Control, a number of my colleagues at the Indiana University School of Medicine and Infectious Diseases, and of course, we're in constant communications with the State Department of Health and the Association, Indiana Department of Education, trying to give out the best recommendations that we can to safeguard our students. But I do want to say we need to be just as conscious of safeguarding our teachers and the rest of our employers, so that anyone that's at risk for chronic medical illnesses that puts them at risk for the coronavirus, we need to take special precautions for those teachers. So let's work on that together. Thank you.
And we are. And I'm a data person, I'm a numbers person, so I've really appreciated this. Thank you so much.
Thank you so much. Okay.
So to our staff and families and community members who are watching this either live or later, thank you so much for your attention and your time. As I end all of these, and I'm sure everyone's tired of hearing, we appreciate your grace and flexibility through this, as Dr. Caine pointed out, an unprecedented situation. we are all working day and night and looking day and night to do our absolute best for Warren Township and our Warren Township community. So thank you again.